To protect our children from child abuse and neglect, we all need to recognize it and know how to make a report. It's important to be able to recognize the basic types of child abuse and their effects on children, and understand the guidelines for reporting suspected child abuse or neglect. Why is this important? Over 3 million reports were made to Child Protection Services in our country in 2011, involving more than 6 million children. Over 670,000 cases were substantiated, 75% of which were neglect. Over 1,500 children died from child abuse or neglect, and 80% of the perpetrators were their parents. Who are the children affected often by child abuse or neglect? Children who are less than 1 year of age have the highest rate of victimization. Overall, girls and boys are equally affected, but more girls are sexually abused and more boys are fatally injured. Having an unrelated caregiver living in the home increases the risk of child abuse or neglect. But it's important to remember that any child of any age, from any family, from any community, may be a victim of child abuse or neglect. The basic types of child maltreatment include physical abuse, sexual abuse, emotional abuse, and neglect. And neglect can take on a variety of forms, including physical needs, medical and dental needs, or educational needs. Physical abuse is any kind of non-accidental injury that results from the act of omission or commission on the part of a parent, guardian, or custodian. So it could be something that the parent did do or something that they didn't do that results in the harm. Injuries are often the result of punching, beating, kicking, biting, shaking, throwing, or otherwise harming a child. But it's important to recognize that it may not have been the intent of the individual to harm the child as severely as they did, but nonetheless, they did inflict the injury, and it is therefore physical abuse. Physical abuse often involves the head, face, and neck, and these injuries occur in more than half the cases of child physical abuse. Sexual abuse is any kind of sexual activity that is inappropriate for the child's age, level of development, or role within the family. This conceptual definition helps differentiate what may be normal sexual experimentation among 2 4-year-olds that is clearly distinct and different from sexual activity between a 4-year-old and an adult. These activities can include fondling a child's genitals, penetration, incest, rape, sodomy, indecent exposure, and exploitation. It also includes pornography. And neglect is the failure to provide for a child's basic needs. Those basic needs include necessary food, clothing, shelter, and appropriate supervision, one of the most common causes for neglect. Medical neglect includes not paying attention or providing for necessary medical or mental health treatment. And educational neglect is failure to educate a child or attend to their special education needs. Emotional neglect is inattention to the child's emotional needs. Emotional abuse is a pattern of behavior between the child and parent that damages a child's emotional development or sense of self-worth. This can include activities such as constantly terrorizing and frightening the child intentionally, ignoring the child, isolating them frequently, or corrupting and exploiting the child. Those would be activities such as having the child sell your drugs because the child won't get as much trouble as the parent would. And constant rejection of the child is another form of emotional abuse. In order to identify child abuse or neglect, one must be willing to consider the possibility that it occurs. If you don't think about it, you won't ask the right questions, and you will not make that call that could save a child's life. There are a number of red flags, or those big markers, that should make you think about the possibility of child maltreatment. It's important to recognize that as you see lists of behaviors or injuries that should make you think about the possibility of child abuse, they suggest the possibility, but in isolation, they don't usually prove it. There are behavioral indicators, changes in behavior, physical indicators, bruises or injuries, but it's important to use common sense in deciding and figuring out, does this really make me worry about abuse, or is there some other good explanation for what it is I'm seeing in the child? Common sense takes into fact normal development. You don't expect a 3-week-old child to be crawling over to the top of the stairs, so they couldn't possibly do that before they roll down. However, the child who is running and climbing and tumbling can get into all kinds of accidental injuries. We're all familiar with toddler bruises. Kids who are learning to walk frequently fall and bump their foreheads or get bumps and bruises on their shins. But they don't bruise their bottoms. They don't bruise their abdomens. They don't bruise their backs in those normal activities. Another common thing to recognize is that diaper rash is very common in children in diapers as well as young children who are in the process of learning toileting. And we don't want to confuse diaper rash and immediately jump to the possibility of sexual abuse because there's redness in the genital area. We have to think about those life events and normal sorts of activities that the children are involved in. The injuries that a child may get learning to ride a bike are going to be very different from the child who's learning to roll over. The child learning to roll over should have no injuries, but riding a bike could cause a number. What are some of the signs of possible physical abuse in the child? When the child has an injury that does not make sense for the child's age or development, such as the 3-week-old who supposedly crawled to the top of the stairs, the infant with bruising anywhere on the body or blood in the eye or the mouth is a huge red flag. Infants rarely get accidental bruises. Any bruising of the trunk, the ears, or the neck in a child who's less than 4 years of age is a big red flag, and patterned bruises or burns, injuries that have marks that outline or identify the object that was used to inflict the injury, are another sign of possible physical abuse. Bruises on uncommonly injured body parts, also a big red flag. We see kids getting bruises on their shins and on their foreheads, but it's rare to see accidental bruises on the abdomen, the chest, the buttocks, or the ears. A child who has multiple serious injuries at different stages of healing, especially if they're in unusual locations or totally unexplained, should again raise some level of concern. Any child who reports that they are being physically harmed or injured should be taken seriously. What about the signs of sexual abuse? Any child who reports sexual touching should be taken seriously. Any unexplained genital pain or bleeding. And unexplained means after a good medical evaluation, there is not a good explanation or medical condition that would account for the child's bleeding. The young child who demonstrates bizarre, sophisticated, or unusual sexual knowledge or behavior is a red flag. We have to think about where did this child learn these activities. The child who asks unexpected or unusual questions related to sexual activity would fall into this category as well. We have to contemplate and decide what have they learned, what are they seeing versus what are they experiencing. And any child who becomes pregnant or contracts a sexually transmitted disease at less than 14 years of age is a sign of sexual abuse. What about the parents? When the parent offers a conflicting, an unconvincing, or no explanation at all for a child's serious injury, that raises the concern. If the parent shows little concern for the child, sees the child as entirely bad or evil, if the parent demands a level of performance that the child cannot attain, often child abuse occurs in the context of a child crying too much or a child who wets their pants. Parents expecting them to not wet their pants, but in fact, that's obviously going to happen. The parent who denies the existence of or blames the child for problems in home or at school, the parent who uses harsh physical discipline, all red flags. And when there's domestic violence, drug or alcohol abuse in the home, or mental illness in the home, the risks are higher to those children for possible maltreatment. The key issues in identifying and recognizing physical abuse is a story about what happened that doesn't make sense for the type of injury that the child has, or the story may not make sense with the type of abilities that the child would have. The child that has no history for a significant injury or multiple injuries of different ages. And again, any infant with an injury, a bruise, a burn, a fracture, a mouth injury, should be extremely alarming and should warrant additional evaluation for possible child abuse or neglect. Any bruise in an infant is a huge red flag. Here we have an infant with a black eye, another infant with bruising and injury inside the mouth, and a third infant with just this little red mark over the eye. But that little infant with the red mark over the eye, when evaluated, had 17 fractures. And he was evaluated only because he had that bruise above his eye that was recognized as something that shouldn't be there. A slap mark or bruising in and around the ear in a child of any age is very worrisome for an inflicted injury. Obviously, the slap mark is an inflicted injury, but bruising in and about the ear is often the result of jerking or yanking on the ear. This is a dip burn, and when children get burns that suggest a pattern that they have been immersed in hot water, that should immediately raise the red flag for possible maltreatment. You don't bruise until you cruise. It is extremely rare for children who are not yet able to walk along furniture or pull themselves to stand to get themselves into a position where they might get a bruise. Even young infants who have siblings who may sometimes get a little rough with them will rarely, if ever, have a bruise. The literature documents that fewer than 1% of children less than 6 months of age will have a bruise. All citizens in Indiana have a legal obligation to report concerns of possible child abuse or neglect, even if someone else disagrees with them. We as citizens cannot investigate or handle the problem alone. It requires a joint effort. And it's not our jobs in general to do that legal investigation. The reporter's identifying information is kept confidential unless it is necessary in court. When should you report? You report to Child Protection Services when you have a reason to believe that child abuse or neglect may have occurred. That reason can be based on what you see, what you hear, or what you have been told. It's a misdemeanor not to report if there is a reasonable suspicion of child abuse or neglect, and there is immunity from civil or criminal liability for a good faith report, a report you made because you were honestly concerned about the child. To make a report, you call the Indiana Child Protection Services hotline at 1-800-800-5556. If you see something happening in front of you or there's an immediate concern, you call 911 to have someone respond immediately. Telling a supervisor or coworker in your place of work is not sufficient unless you are clear that it has been reported. Your employer will often have additional steps that must also be taken, but again, you need to be sure they've made the report if you are suspicious. When you report, you should be providing the concerns and reasons that you are reporting and what it is that you suspect. If you don't provide the detail, the authorities will not know what to investigate. You may report anonymously, but then the authorities cannot get more information from you if it is needed. Once you call the hotline, an official report has been made. The report is reviewed by a CPS supervisor who determines if there is enough concern to begin a formal assessment of the situation. If so, the case is assigned to a caseworker whose job it is to assess the concerns and determine what services or protection, if any, are needed for the child. Child abuse casts a shadow the length of a lifetime. Remember that lack of reporting contributes to continued victimization by failing to acknowledge that a child may be at risk for further abuse. Your job is to protect the child.